Hello, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Before I give the update today, I need to send a shout out to Judy in Northern Public Health District, who sent me this snazzy mask that very proudly displays that I am fully COVID vaccinated. So thank you, Judy. We appreciate our partners all around the state that are working hard. So I want to just, again, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Facebook Live on April 2nd to update you on the impact of the COVID-19 pandemic on Mobile County and about our vaccination efforts and other events going on around town. So I will just skip straight to the Mobile County numbers today. We are reporting on 50 cases that were reported to us yesterday. This was a little bit higher than it normally is because we had one location who was doing a little bit of catch up. So 50 cases reported yesterday, bringing the total to 37,664. We had 0 deaths reported yesterday. That stays at 794. One additional person hospitalized, so the cumulative number of people hospitalized, 4,819. And yesterday there were 14 people in the hospital with COVID-19. So that was down from one the day before. So for the past 4 days, Monday through Thursday of this week, there have been 15 people or less in Mobile County hospitals with COVID-19. So that is just really good news. Remember that you can always get the statewide data by going to alabamapublichealth.gov and checking the dashboard hub there. They give information on the statewide and county level cases, on statewide and county level risk indicator. And now, effective today, they are giving state and county level vaccine doses delivered and doses administered. And when you can also see demographics at the county level. So you can see how many, what proportion of male and female have been vaccinated. Of the race populations, you can see what percentage of people have been vaccinated by race, and then also by ethnicity and age group. I think those are the ones on there. So go and take a look at that. So a couple of questions today. One asking about the new eligibility. So again, the governor today made an announcement that beginning Monday, April 5th, vaccines will be available to all individuals ages 16 and older. Now, we have a clinic going on right now, a first dose clinic down at the cruise terminal. And if you are in that age group, 16 and over, we will go ahead and vaccinate you today if you can get to the cruise terminal before 4 o'clock, I think, is how long they go today. So again, all individuals age 16 and older. So we're really excited about the governor and the state health officer agreeing to open the eligibility requirements to anyone who is above the age of, who is 16 or older. There is a lot of vaccine out there now. The federal pharmacy program has been pushing vaccine to more locations. You might have heard that Winn-Dixie pharmacies in some locations have vaccine now. Lots of other CVS, Walgreens, that sort of thing. Private pharmacies, doctors' offices, hospitals still have vaccine. Walmart pharmacy has vaccine. I think Sam, so lots of places to get vaccine, and you can go to look for a place near you at vaccinefinder.org. Now, I do want to mention the first dose clinics that the Mobile County Health Department is sponsoring. And on Monday, since the governor lifted any restrictions on vaccine, who can get the vaccine, we are going to open the cruise terminal on Monday from 8 to 6 and give a first dose Moderna vaccine clinic. So again, Monday from 8 to 6 at the Alabama cruise terminal, we will be giving first dose Moderna vaccine from 8 till 6. That's at 201 Water Street. Then on April 12th and April 13th. So 2 consecutive days from 8 a.m. to 8 p.m. We're going to be in Calvert, Alabama at the Eric Hine Learning Center on number 4 2nd Street in Calvert, Alabama. This is in the north part of the county. Again, April 12th and 13th from 8 a.m. to 8 p.m. Both of those days we'll be giving first dose Pfizer vaccine to anyone in the community or surrounding areas that wants to come and get vaccinated there. Again, it's the AIDT Eric Hine Learning Center at number 4 2nd Street in Calvert, Alabama. And as we announce other first vaccine doses, we have several planned next week, several vaccine clinics planned at locations outside of the cruise terminal, and we will be getting those finalized and posted on our website at mchdcares.com as soon as we can. So keep checking mchdcares.com or call us at 410-MCHD. All right. One point of clarification, we get asked sometimes, does someone between the age of, that's at least 16 but less than 18, do they have to have a parent consent to receive the vaccine? The answer is yes. And again, keep checking back to our website for vaccine clinics, but because the eligibility's been opened up, we're going to add the cruise terminal on Monday and then carry out the other events next week that we have planned. I think we have one planned for Dolphin Island. We have one planned, I think, in the Pritchard area. And I don't know the details about all of that. It's another team that's figuring all of that out. But as soon as we get that information, we'll post on our website, and then I'll talk about it on Monday. All right. Someone asking me if it's okay to get vaccinated if you're allergic to penicillin and take low-grade aspirin on a daily basis. And also wondering if you can get the vaccine if you are on pain relievers. And the answer is yes. Get vaccinated. There is no reason to defer vaccination if you're allergic to penicillin or if you take an aspirin or if you take other types of pain relievers. This will not interfere with the effectiveness or the safety of the vaccine. Okay, someone asked, they noticed on figure 12 of the weekly report about a yellow circle in the middle of a zip code. So I have figure 12 here. I'm really happy that folks are paying close attention. So the yellow circle indicates a large number of cases in a very close geographic area. And that yellow circle that we reported on last week is due to catch up. So it was a detention center who is catching up on a backlog of cases to report. So not recent cases, but some that had happened over the last couple of months. So no need to worry, but kudos for checking that out. What happens to the spike protein after the vaccine is administered? So here is another question, and I'm going to Dr. Scott Chavers, our vaccine epidemiologist, had previously answered this question, so I'll just read what he wrote. The spike protein will eventually be broken down, but it's much more stable and remains active through the priming and booster period, so 14 to 21 days after each dose. So that is the answer to that one. What do I do if I've lost my vaccine card? How will I get my second dose? I don't know how other locations are doing it, but at the health department, if you got vaccinated at the health department, if you've lost your vaccine card, when you come back for your second dose, then we'll look up your record and confirm that you received your first dose, confirm what product it was, and then we can give you a replacement card. If you have lost your card after your second dose and you want to get a copy of your vaccine record, you can contact the health department and we will look up, and I'm not sure there's a charge for that, but anyway, contact the health department if you've lost your card after receiving your second dose, and we'll see what we can do to print your immunization record and get that to you, because you really need to have that and keep it. All right, another question, do you have to pay for the vaccine if you don't have insurance? No, this is federally funded vaccine, so there is no out-of-pocket cost to the individual. We don't even, sometimes we ask you for if you have insurance, and if you do, we'll jot it down because we can sometimes get reimbursed a small amount of money for the administration of the vaccine. But if you don't have insurance, don't worry. We'll file an uninsured claim, and but it will not cost you anything. All right. Here's a question that came in at the last minute. I have not looked at it until now. Says, is there a way to find out if any of the vaccines available here do not have the same base as the Tdap? And these are messenger RNA vaccines. They are a totally different construct from Tdap vaccine. So I hope that answers that question. Someone from the media asking if we were going to open up to 16 and older today, and I think I already answered that. Yes, our clinic that's going on at the cruise terminal, if you are 16 and older, we're giving Pfizer down there today, so 16 to 18-year-olds can get vaccinated with Pfizer. So yes, you can go to the cruise terminal today to get vaccinated. All right, already talked about that. I think that is most of the COVID information that I wanted to share. Well, maybe just one thing. There's already a line of traffic backed up at the tunnel, people trying to head east for, spring break or Easter celebrations. So just want to read some things, remind you of ways to stay safe during your travel and during gatherings that might occur over the Easter holiday or at some of the favorite spots, the favorite destinations during spring break. So the safest way to observe Easter this year is to celebrate with people you live with and with others virtually. So remember, outside is also the safest way. But you still need to stay 6 feet apart to protect yourself and your loved ones from COVID-19. Unless you've all been vaccinated. And if you're in the same family and you've all been vaccinated, then you can enjoy Easter by being a little bit closer. You can always, again, enjoy a traditional meal with people who live with you, but it's higher risk when you invite other people to come and have, Easter supper with you or Easter lunch. Let's say a few holiday customs like Easter egg hunts, that's fine to have those outside, but make sure you're wearing a mask and staying 6 feet apart from people that don't live in your house, just to give you the best protection should there be people hunting eggs and mixing with your children and neighbors who might be infectious. Attend religious services virtually. I get a lot of questions about, is it if we're vaccinated, is it okay for us to, not distance at church? And the safest way is to attend religious services virtually. If you do attend in-person religious services, you must maintain that 6-foot distance from people who don't live with you, and you need to wear your mask. Remember, some of the things that happen in that setting, like singing or hugging or shaking hands, all those things raise the risk of COVID transmission. And remember, right now we have less than 30% of our population vaccinated. So it's still really important that we continue to wear a mask and physically distance. And another thing that might be good is a good tradition to start or continue is to, prepare and deliver a meal to a neighbor or to a family member that you might have celebrated with in person last year, just to continue to make that personal connection. All right, now on to two things different. One is, we're continuing to support rabies vaccination clinics for companion animals, dogs, cats, and ferrets, primarily. Only dogs, cats, and ferrets. I know there are other companion animals, but for rabies clinics, we have one this weekend, Saturday, tomorrow, 1 to 3 at the City of Mobile Animal Shelter on 855 Owens Street. And we will have vaccine clinics throughout the month of April on each weekend, either Friday or Saturday. So make sure to go to our website or look on our Facebook to see where those clinics this week are those clinics are held. This week it's in at the City of Mobile Animal Shelter. Then we'll be at the County Animal Shelter on the 9th, at Pet Supplies Plus on the 10th, and at Cuddles and Kisses on the 17th, and City of Pritchard Animal Shelter on the 24th. So lots of different ways to go and get a low cost. It's $12, cash only. Stay in your car. So most of these are drive-through. All right, and then we also have announced that next week, April 5th through 11th, is National Public Health Week. And we have released some information on, what the health department will be doing to celebrate National Public Health Week next week. So the theme this year is Building Bridges to Better Health. And we will have sort of daily themes. So Monday, it will be rebuilding after the pandemic. Tuesday, it will be advancing racial equity. On Wednesday, strengthening community. Thursday, galvanizing climate justice. And Friday, constructing COVID-19 resilience. Then on Saturday, uplifting mental health and wellness. And Sunday, elevating the essential and health workforce. So please, if you know someone who works in public health, just maybe take a minute next week during National Public Health Week to thank them for the work that they do, usually very silently, to protect our community from disease and injury and death and all of, through vaccination, through, breastfeeding programs, through mental health programs, through communicable disease work, vector, and mosquito abatement, food and lodging inspection services, social services, pediatricians, dentists, adult health, Ryan White, you name it. We do it in a lot of different ways in a lot of different areas. So please, if you know someone who works in public health, give them a little extra shout out next week if you have the opportunity. So I will stop for there. Remember, we will be giving doses today with the new criteria through 4 o'clock. And there may be a little bit of traffic because everybody's trying to get out for the weekend. But once you get to the cruise terminal, there's really not been any waiting today. So please head that way if you want to get vaccinated. So we'll see you Monday, and we'll have a lot more information on the other opportunities for first dose vaccine next week. And again, get vaccinated.